Welcome to WealthCare. Today we're looking at a major new development in Medicare's value-based care strategy, one that promotes greater stability and inclusivity, the CMS ACO LEAD model. We'll break down what it is, why it's different, and what healthcare leaders should be thinking about right now. ACO LEAD stands for Long-Term Enhanced ACO Design. It's CMI's new voluntary accountable care model. Starting in 2027, LEAD introduces a 10-year runway designed to transform and expand care in traditional Medicare. Unlike past models, LEAD offers a stable benchmark, avoiding the resets and uncertainty that troubled earlier ACO programs. This structure is meant to support long-term planning and sustained investment in care transformation. To really understand LEAD, it helps to look at where we've been. CMS has tested several accountable care models over the years. The Medicare Shared Savings Program was the starting point, largely focused on upside-only savings with limited risk. That evolved into models like NGACO and GPDC, which introduced more flexibility and greater risk sharing, but also brought significant operational complexity. More recently, ACO REACH added additional safeguards and a stronger emphasis on equity, though it too has faced limitations and is set to conclude in 2026. Each of these models introduced new ideas along with new challenges. We've broken these models down in more detail in other WealthCare videos. LEAD builds directly on what CMS has learned from earlier Medicare value-based care models and represents the next step forward in traditional Medicare. Historically, many of these models were short-term pilots. Benchmarks changed, flexibility was limited, and smaller or rural practices often faced real barriers to participation. Payments were still largely tied to fee-for-service, and there were few tools to meaningfully change how care was delivered. LEAD is designed to change that. It introduces a long-term, 10-year structure with more predictable benchmarks, giving organizations the stability they need to plan and invest for the future. It expands access for independent and rural providers and supports more flexible, population-based payments that improve cash flow. LEAD also goes further by enabling new patient incentives, care delivery waivers, and better alignment with specialists, without adding unnecessary contracting complexity. At its core, the main goal of the CMS ACO LEAD model is to make accountable care in traditional Medicare practical, sustainable, and inclusive, especially for independent, rural, and physician-led organizations, while improving patient outcomes and controlling total cost of care. Despite its promise, ACO LEAD is not without risk, and those risks tend to fall into two main buckets. First, there's operational and financial execution risk. LEAD introduces real quality and financial accountability. Success requires strong analytics, disciplined care management, and well-integrated clinical workflows. Organizations need timely data, physician engagement, and the ability to act on insights, not months later, but in real time. For smaller and independent practices, this can still be a heavy lift. Even with improved design and better cash flow, operational readiness remains critical. LEAD lowers barriers, but it does not eliminate the need for infrastructure, governance, and disciplined execution. The second risk is external, political and perception risk. Because LEAD builds on concepts that originated in direct contracting and ACO REACH, it continues to face scrutiny from policymakers and advocacy groups concerned about incentives, privatization, and cost control. Leaders will need to navigate these narratives carefully, remain transparent, and stay grounded in clinical outcomes and patient experience. For healthcare leaders, ACO LEAD is not just another CMS pilot. It's a clear signal about where value-based care in America is headed. There are 4 things leaders need to understand right now. First, provider-led accountability is here to stay. CMS is reaffirming that physicians, not just payers, are central to Medicare's future. Second, execution matters more than participation. LEAD rewards organizations with strong analytics, effective care management, and clinically integrated workflows. Third, independence and competition matter. LEAD is intentionally designed to support independent, rural, and physician-led practices without forcing consolidation. Fourth, long-term thinking is required. With more predictable benchmarks and a 10-year runway, LEAD favors organizations willing to invest in care transformation and prevention. To sum it up, ACO LEAD represents CMS's clearest commitment yet to provider-led, long-term accountable care in traditional Medicare. It's about stability instead of unpredictability, flexibility instead of rigid rules, and giving physicians the tools to truly manage population health. For more clear executive-level insights on healthcare policy, strategy, and the business of healthcare, make sure to like this video, subscribe to the WealthCare Inc. channel, and follow along for future content.